So next we'll move on to the respiratory system. So under respiratory system, we'll be discussing initially the normal structure and anatomy. Then we'll see about bronchogenic sequestration, acute respiratory distress syndrome, then the various obstructive lung diseases and restrictive lung diseases, then the granulomatous diseases, pneumonia and lung tumors. So let's start with the normal anatomy first. So the trachea will be bifurcating into the right and the left bronchi, which then divides into further bronchioles. So the bronchioles will then move on to the terminal bronchioles, and then respiratory bronchioles come. Then after that, it forms the alveolar ducts and the alveoli. So the last three structures, basically the respiratory bronchioles, alveolar ducts and the alveoli together form the major functional unit of the respiratory system, which is the SNS. So whenever I mean SNS, it means these three structures together, okay? And in the trachea and the bronchi, if you see, the cartilaginous part is more. So as and when it divides and comes beneath, that is still when it reaches the lung parenchyma, the cartilage will decrease. And similarly, the maximum amount of smooth muscles is going to be present in the terminal bronchioles. So if we see the lining of the epithelium in the respiratory tract, it is all lined with the pseudostratified ciliated columnar epithelium, except. So pathology always deals with exceptions, right? So except it in the vocal cord, it is going to be lined by stratified squamous epithelium. And in the alveoli, if you see, the alveoli is going to have two type of cells. So suppose this is the alveoli, there are going to be these flat kind of squamous cells, which is the type 1 cell. While there are going to be some bigger columnar kind of cells, which are going to be the type 2 pneumocytes. So the function of these type 2 pneumocytes is mainly to repair. So whenever the type 1 pneumocytes are being destroyed, the repair is done by the type 2 pneumocytes. And then also the most important function of the type 2 pneumocytes will be surfactant production. So surfactant is the one which is responsible for the compliance of the lung. So if the type 1 pneumocytes I mentioned, it was the flattened or squamous kind of lining, which is the major respiratory epithelium in the alveoli.